Yale Forbes Oral Communications 111. Trying to conceive a child can be a time-consuming and often emotional task. Medical advances today make the goal of achieving pregnancy a reality. I have worked in the field of obstetrics and gynecology for over 5 years as a medical assistant and have seen women in various stages of her life. According to Infertility, a new Harvard guide to women's health, today, 10 to 20% of all married couples are infertile, and about a quarter of all women can expect one episode of infertility during her childbearing years. I will discuss how and when a woman is fertile today, what testing should be done, when that testing should start, as well as what methods a specialist would take to achieve pregnancy other than intercourse. According to the website for Shady Grove Fertility Center, a woman has different phases she goes through during her menstrual cycle. Women's monthly cycle starts from the very first day of her menstrual cycle, of her menses. Days 1 through 13 is the follicular phase. Glands in the brain secrete hormones, which is called a follicle stimulating hormone, or FSH. The FSH stimulates the development of a follicle, which is a tiny fluid-filled sac in each ovary containing a mature egg. Approximately 14 days before the next cycle is the ovulatory phase. When a mature egg is released into the fallopian tube, a woman has the best chance of conception right before or during the ovulatory phase. Days 15 to 28, hormones are released to support a fertilized egg. After 18 days, if the mature egg is not fertilized, the cycle starts all over again. Ovary, fallopian tube, uterus. Most women begin treatment at their OBGYN office. Speaking with Dr. James, who is an OBGYN and member of FACOG, recommends that infertility is usually diagnosed after 1 year after unprotected sex for women that are under 35, 6 months if you're over 35. Once these have been unsuccessful, the first test she would do is the blood test to check for the FSH and the LH during the first and second phases of a woman's cycle. The male partner should have a sperm count checked to make sure he is not the cause of the infertility. A hysterosalpingogram, or HSG, should be done. The HSG is a test that is done in a radiology office and is to check to see if there's any blockage within the fallopian tube. A dye is pushed through the uterus and recorded to see if the dye spills out through the fallopian tubes, as described in the textbook Infertility Disorders. Some disorders, as described in the Human Book, is an illustrated guide to its structure and function of these disorders. Describes how a woman could have blockage within a fallopian tube, like endometriosis, which is fragments of the uterine lining that become embedded in the tube, or from sexually transmitted disease such as chlamydia, causing pelvic inflammatory disease that causes scarring of the tissue of the tube. Medications that are prescribed in the doctor's office, such as Clomid, stimulate ovulation and are often given to patients in the OBGYN office. Once a patient has tried the most simplest solutions, she is referred to the reproductive endocrinologist. During the consultation with these specialists, a mode of treatment is discussed to see what would be the best plan of action for the patient. 2 major procedures that are done by a fertility clinic are called an IUI, or intrauterine insemination, or IVF, in vitro fertilization. IVF is a process by which an egg is fertilized by sperm outside the body, removing a mature egg, and the fertilized egg is placed back into the uterus. Couples who do not have a male partner can also use the IUI, as a man's sperm is injected into a woman's uterus to help the sperm reach the egg at closer range. There are, however, no guarantees that trying to have a baby can be very frustrating and emotional, but given the right doctors and circumstances and with a little bit of luck, these goals can be achieved. Above all, extending a family is more than getting pregnant, and sometimes those expectations are not met, and this can be devastating, but there is always a child in the world who could benefit from a loving family. And adoption is an option for those couples who do not require and cannot get pregnant.